Do you ever wonder how your baby got out of your body in the first place? In this video, I'm going to explain to you the mechanics that happens in the pelvis to get your baby out and how it might still be affecting your body today. Hi everyone, Lynn Schulte here, Women's Health Physical Therapist of Intuitive Hands Physical Therapy in Boulder, Colorado, and I am your postpartum recovery expert. So today we want to talk about common birth pattern that happens in the pelvis when we birth babies vaginally. And I start to see this kicking in around that 36, 37 week as the baby's head starts to engage into the pelvis. And these shifts and things start happening in the pelvis. So the first thing that I notice, here's your sacrum in the back, okay? And these are your two big iliac bones on either side. And as that baby's head engages into the inlet here, I find that the sacrum, so the sacrum back here, it shifts off to the right. So the tailbone kind of shifts off to the right, and there gets to be a jamming up here into this right SI joint, sacroiliac joint. That's right where the sacrum and this ilium meet here. And so as for some reason, not quite sure why the sacrum does this, but I find this a lot in women, is that the sacrum moves over and gets jammed up here into this right-hand side. And so that may also kind of help this area open up a little bit, not quite sure. But the sacrum in the first parts of birth needs to come back to allow this to widen and get open so the baby's head can come in. And then the latter part, the sacrum, needs to lift backwards to increase this distance here. Okay, so the sacrum lifts up in that latter part, and then the iliac bones open up to the side as well, and that's what helps get the baby out through the pelvis. And so what I find also is that for some reason, this is the left-hand side here, I feel like the bigger part of the baby's head comes through on this side, and so it really hammers this whole area in here more so than the other side. So this left side, pubic bone, pubic rami, and ischium all get really hammered more so than this side. So as a woman is laying down on my table, let's see, this way, and I come to, kind of gently, I use the palm of my side, and I'll just gently kind of push down this side, this right side. Let's see, oh, maybe this way. As she's laying down here, I'll just gently push down on this left side and it won't move and it'll be really hard, and this side will be a lot more spongier and softer. So that's another issue that happens in this